Chaps, Steve and I, Dot's banned me from saying me and Steve, and I've got to go all posh now. But
Too
we
right,
yeah,
grammatically correct.
no,
Thank
exactly,
you.
mate. Well, I'm middle class now, isn't it? Live on a farm. But no, what it is she's been in a video, Courtney Castle. She does like dictation software for like doctors and all this kind of stuff. And she's been in a video ages ago. But anyway, I digress. The video is about the NHS. I think it's by law from October, you can read your GP notes, not just what you had, but also their notes, what they wrote about you.
hmm
And on one hand, I'm like, that's brilliant. On the other hand, I know when it comes down to me and my mental health and my past, especially because I've got BPD and we can hold vendettas for a long, long time. I can I think I would research every single note, and if I saw one bad comment, I think that will trigger me. I don't want to say that will put me into
Well,
depression.
when you say a bad comment, what I mean, tell
I'll,
me what you mean by a bad comment.
I'll give you one example. I won't say the person's name. You already know who it is because we're going to do a video. Is they went in with for an infection in their head or something like I think it was an ear infection. And the doctor, the first note they put on there was health anxiety, which is basically, us old timers call it hypochondria
Yep.
or hypochondriac. So I think there's just little things like that. And I've said this before in a video where I shouldn't say this because we run a mental health charity, but sometimes it does feel like when you're open about your mental health, you've had a diagnosis, it doesn't really matter what it is. People will see that before a real condition. I don't mean how that sounds.
No, so probably they're quite right in the fact that they need to take it into account, in order to sort out the best course of treatment for you and the best way. I mean, I take it back to when I got my cancer diagnosis.
Yeah,
And I was talking to the lung nurse, like the respiratory nurse. This was sorry, I beg your pardon, before I got my diagnosis, but when they thought that I had it. And one of the first things she said to me and to my wife as well is, "How do you want me to phrase this? How do you want me to talk to you?"
right, okay.
And I said, "But what a daft question. Why are you asking it?" I said, "I just want everything straight between the eyes so that I can process it. That's just
Yeah,
the way I'm geared up, just so that I can process it." And she said, "Well," she said, "that's fine." She said, "I did have one lady in here," she said, "who I could call it a growth. I could call it an uninvited party. I could call it anything, provided I didn't use the word cancer." She said, "And I slipped up and used the word cancer." She said, "And she went absolutely berserk at me."
wow.
So, with that in mind, if there is a note on your record to say, don't do this, don't do this. So people do, they do have to read up slightly and see, how does this person deal with this situation before, so which is mental health,
Yeah,
essentially, isn't it? I mean, I was fine. Give it to me straight down the throat. I don't care. I need to process it in my own way. I don't need you canoodling me or wet nursing me through the whole process.
yeah.
I need help, but I just want it straight down the eye. So um I get it. I totally get that, because I think that people need to read up on the notes and say, this person is fragile in this area or doesn't cope very well in this situation or whatever, and assess all of that and deliver the information that they need to deliver in the correct manner.
Yeah, because that's where I'm at. I don't know what side to sit on because I think when I was in my darkest moments, I feel like I'm going to sit there and write a story now. But when I was in my darkest moments years and
We've
years,
we've only got about 15 minutes,
all
mate,
right,
but
okay, I'll skip that. But no, when I was in my darkest moments, I think I would want to read it because there'll be some stuff in there probably I've forgotten. So
Mhm.
I'll be like, okay, yeah, I was batshit mental. And now actually my progression. So on one hand, I'm like, okay, yeah, that's a good thing. I'm just not. It's just that thing of. I think it falls back to even though those notes are there, do I actually, even though I've got the ability, do I need to read them? because I'm not sure if there was one comment what just completely triggered me off for days. You know what? Like, I can get a bee in my bonnet. When I get a bee in my bonnet, that will be dragged out
Yeah,
for a
yeah,
long
yeah,
time.
yeah. No, I get it. I get it.
But I think I'd get more positives. But I think also I've spoken to 3 people. Obviously, we only planned this call like 20 minutes ago, but I quickly had a call with and spoken to a couple of people who, and they're the same. They're just like, I'm not sure I really want to read the notes.
Okay, so there's two sides to that, really, I suppose. I did a very quick bit of research, which I'll come on to in a minute, or I've read an article on the NHS website. So personally, I would want to know everything. I want to know all of my notes. Would I go scurrying around looking for them? Probably not. I don't really care that much. What I will say is that if I ever needed any of that information, I can go and get it. It's my information. I can go and get it from my GP at any time. And in fact, during my cancer treatment, they needed to know, or somebody needed to know, I think it was Macmillan or somebody like that, needed to know exactly what inoculations I'd had. And so I phoned my GP, went straight through to the admin area and just said, can you just tell me what all of my inoculations have been ever since I was born? So that's going back to, when I was 5, I had polio on the little sugar lump. And so, I had the whole lot. And within 10 minutes, it was in my inbox. So the information is there if you really want to get it. Yes, I mean, I suppose if I had nothing better to do in my life, I'd probably want to go through and read my entire medical history. Is it that important to me? Not especially, but it's quite nice that it's accessible.
But I don't think it's the medical history, because I think that's been on there for ages. And I think for me it's more the notes of the doctor's note. And I think that's the thing where I'm just,
Yeah.
say for example, if I went in, I use this guy's where he had an ear infection or a head in something wrong. It was clearly an infection. The first thing was like a hypochondriac.
Hmm.
And I can see his perspective. And if I read a note about that myself, I'm trying to think backward. Not sure. I'm just trying to think. I wouldn't know
You'd
until,
probably, yeah. I mean, you'd probably think, you cheeky bastard.
yeah. No,
How dare
exactly.
you make an assessment on me based on, 3 minutes of me walking into A&E or wherever it is that
Well,
they went to?
it'll be interesting to see what happens on when during COVID, because COVID was all telephone.
Yeah.
Because that'll be interesting. But I think I just don't know where I sit with it really. But I do know, after speaking to a couple of, I think it's 3, maybe 4 people, they're all just like, I don't know whether it pissed me off or not. I
So let
think,
me just précis this thing that I found on the NHS website, which I thought was quite cool, actually. So there's a surgery called Paxton Green, which is a large practice in London, 19,000 patients.
wow.
So in all of their they use this thing, it seems, this SNOMED clinical term enhanced system, which is the way that all the whole thing is kind of held together. So I suppose the language that it's speaking and the way it's held on the database and all the rest of it. Anyway, I think that's NHS specific.
Yeah.
So they've got this very, very, very long code with either a 104 on the end of it or a 106. And they actually sat down and discussed every single patient, whether every single patient should have access or shouldn't have access. So everybody by default has a 106, this very, very long number with a 106 on the end of it, which seems to suggest that they have access to everything.
Wow.
Okay.
Yeah.
If they change that and put a 104 on the end of it, so this long number with 104 on the end, they can't. So some of them they put on automatically, some of them they put on pending some sort of a discussion with either the carer or the person themselves, if the person themselves were not capable of having that conversation with their carer, to
Yeah.
see whether they actually wanted access to it or not. Predominantly because they felt that a lot of people would mentally suffer or would be at risk by having that access
And that's
easily available on their NHS app.
that's funny you said that, actually, because somebody I was speaking to literally a few moments ago, that they were just like, oh, my mum was always taking me to the doctors for phantom stuff and stuff like that. She's like, that's the bit what triggered me off. and that maybe I hope well, no, hopefully there is a process where there's got to be some sort of judgment call, isn't it? Judgment call where go actually that could be quite triggering. So before we give
Well,
you,
they've done it with 19,000 patients, of which they've withheld, They've used the 104 code on 300 patients.
so I'm presuming those people would. I guess you don't know because you've only just researched, but so I'm presuming those people would have to apply to further.
Well, no, they've taken the judgment call. So all of their GPs have a fairly good idea. I mean, they can't know 19,000, but far better to put them on the 104 code, can't see, than the 106 code, access to everything, and then have a conversation with them. But obviously, but clearly the people that have any sort of a mental, what do I call it? A mental issue, or is likely to be triggered by the notes that are in there. Yeah, then they would just automatically just put them on a 104 code.
I hope this might backfire now. Actually, I hope that's what they do. I hope that's what they're doing. I haven't researched it. I saw that video by Courtney earlier on. I was like, bloody.
No, I'll send you the link through because it's actually quite interesting. And they have a chat with this person who's their IT operations manager.
Right, okay.
About how they've done it. It seems like they've been running it for over a year because they've actually got outcome a year on from switching on access. I would say that all our staff are now confident in the systems we implemented. It now feels very much like a business as usual.
All right, so maybe they're the first ones to do it, and they're scaling it out or something. Then, so I think it goes down to would a horrid note from a doctor, I don't know, if the doctor put knobhead, I know they wouldn't, but I'm choosing that as an example.
Yeah, no.
I think he's making it up. Would that trigger me into something? I think it would, but I think it also goes down to, taking responsibility for ourselves. And how I mean by that is, even though I know that information is there, if
do you want to access it?
Do I really need to access it? Because the NHS have looked after me pretty well. Yeah, there's a couple of things where I think they've got stuff wrong and whatever else. But I've got no intentions of suing the NHS. It doesn't change my life whatsoever. And I think,
but supposing you're in a situation where you've lost somebody or you really have been, badly treated, those notes form part of a criminal trial, effectively.
Yeah, no, absolutely, and that's something I think we should steer away from as a charity. But I agree with you. I think in those circumstances, it's one of my friends else. There's something where they still to this day think that something was missed. With that circumstance, I massively support. But I think in the overall circumstances, like people like me, basically nutters, just because we've got access, if we think something's going to trick. Here's an example. I don't, as you know, I don't watch the news because it just puts me in rages.
I can understand that.
Do you get me? It just drives me nuts. I just avoid it. Obviously, I see the odd headline, but I don't read the news as in like the older generation do. But it's just so I know it would cause me problems. So I think maybe that's something with the NHS records. If you honestly if you're in a good place and you honestly think, actually, do I really? I think we need to ask: do we, just because it's there, do we need to look at it? Because if we do, it could trigger us.
Yeah, but what you've got to remember is that the people that will mostly be badly affected by it are the people which will go in and have a look.
Yeah, absolutely. But does that not end with
because if you're not at that stage, I'm not even talking about life. I'm talking about at that very point in time. If you're not mentally on an even keel,
yeah,
and you go and have a look because you're not mentally on an even keel, that could trip you right over the other way.
So maybe the solution is just don't, isn't it?
Well, yeah. Really,
trouble is there is no solution, is there? But I think it goes to, and
there's no solution that's good for everybody.
No,
there's no one size fits all. You can't do it, and that's why I think this surgery probably has come up with with a better plan, because
I love that.
they've actually gone through pretty much all of their patients and said yes, no.
And that's 19,000 of them.
19,000 have gone through. I mean, I don't know how many GPs there are there. I mean, you know, there might be 20 GPs there, in which case you'd make fairly short work of it. But obviously, some of them are going to be part-time probably as well.
Yeah, no, absolutely. But there we are. I think if when it's released that's the format, that's the one I think I fully support. But I also fully support full access.
I think you should have full access,
Yeah,
but maybe that needs to be requested rather than just delivered to you on your phone, you know, just like that.
yeah. I think that's fair. Yeah, I think that's fair enough. So I don't want to keep repeating, because I think we just need to be very, very clear and actually long hard think of ourselves as just because it's there, do we need to look at it?
I
Because
suppose the argument comes on, you know, if using the NHS app, does it automatically get delivered to me? If it automatically gets delivered to me, that's probably not a good thing.
yeah, absolutely.
If I have to request access to it, even through my app, and say, yes, I want to see all of my doctor's notes, so opt in rather than opting out,
Yeah,
then
yeah,
that would be an easier way of doing it,
yeah. I think that's what I would agree with.
or a fairer way of doing it.
Yeah, no, I'd have to agree with that, especially when you go, I don't want to go down the whole GDPR things of mobile phones getting stolen, whatever else. That's not even,
Yeah, okay, yes.
no, it's not. It's not even relevant to this at all, is it? But I think I do like to.
Well, kind of is, because does somebody kind of then have access to your notes on your phone, which has been nicked?
I would have thought the NHS would have covered that.
It's only going to be a login.
Yeah, no, all right. Let's not do the whole.
I know, but it's no different to your bank, is it really?
You know, exactly that. All people need is your PIN number, isn't it? So, but that's a valid point. It's no different to your app and everything else, is it?
Mm.
But I think after this conversation, I think just because it's there, I don't need to look at it. Exactly the same as why I don't look at the news and I don't really look at my social media. I think even on my Facebook feed, I literally see you every now and again, and that's pretty much it. I literally see the same three people, and I never scroll down anymore, because it's just crap. What's the point of looking at it? Because it's just going to piss me off.
Yeah. Well, yeah. If you know it's going to have that effect, then it's kind of pointless, isn't it? Really.
I think that was one of the most interesting videos, but also the shortest videos we've done.
Yeah, and I think it's probably only the start. I think there may be more stuff that comes out of this.
Oh yeah, no, absolutely. I think it does. It does. This is where I'm a massive supporter of the NHS. I'm alive because of the NHS.
Oh, likewise.
No, exactly. So I'm a massive supporter of it. Is it perfect? Well, we all know it's not. It's under budget and under thing. Then absolutely, it needs more. But obviously, we'll stay clear of the politics by legal reasons. Just before anyone bats an eyelid on that one, it's because we're charity. We're not being sued by the government, so don't worry about that yet. Yeah. So where I was going with that one, but I think, where was it going? I forgot where we're going.
I don't know. No, well, I think you were either praising or slagging the NHS.
No, I'd never ever slag off the NHS. But
no, I wouldn't. No.
There was a real magical moment of wisdom,
which is now past.
Which is now past. Absolutely. It's happy days. I think our work is done, isn't it? That was.
Joy. Yeah, I think so. Yeah. Watch here for continued discussions on it. I think at some stage.
So just on that bombshell, are we both mutually agreed? Just because it's there, you don't have to look at it.
Yes, I think so.
Because to me, actually, there is, I think, phase. She's like, why do you need to look at it? And actually, that's a valid point.
But the trouble is, the temptation is there.
Don't you start?
Well, no, the temptation is there because it's sitting there on your app. You know, and to my mind, that's the same as, you know, living in a house with an alcoholic and having a bottle of gin in the cupboard.
Yeah. Yeah, no, absolutely.
Do you know what I mean? You know, if you don't want your alcoholic to even pick up, get a shot of it. Don't even have it in the house.
Yeah.
Then the temptation isn't there.
Yeah, absolutely.
To my mind, anyway.
Yeah, no, absolutely. I agree with it. Sounds like Faye. Faye doesn't have any social media apps on her phone. There you go. And on that bombshell, I think we're done then, aren't we?
I think we're probably done then. Yeah,
Cool,
cool.
excellent. Cheers for stepping in. I completely forgot about the group video, but I think it's a good little video. So happy days. Let me hit the record button 1 second. Very well.